The first experience I remember having to call about was my husband had fallen down the stairs and had done something to his heel. And they were very, very helpful, very patient. You receive a instruction sheet kind of about how to approach your provider about negotiating a discount. And that worked very well. It was very straightforward, and the entire need was shared. So we ended up not really paying anything out of pocket because it was so greatly discounted. And that was really marvelous at that time, to have people praying for me, and also not have to have the concern about how would we pay for this and what would our deductible be. We didn't have any of those concerns. We'd done quite a bit of sharing of other people's needs up until that point, and that was always, a joy to do. But to be on the receiving end was really very humbling. And it was really great fun, having somebody respond, with a scripture for us, or, to know they were praying for us. It was really exciting to connect with people from all over, who cared about us and were sharing our need. It's interesting. Samaritans actually caused me to be a better consumer of healthcare. Having learned that medical facilities are running a business. And when I've approached, I had to have an echocardiogram years ago, and I knew that, it was going to be something that I would ask to have shared. And so I just started doing my research in advance, and I called the hospital and I found out what their costs would be, and I called my dad's cardiologist, and I found out what his costs would be. And when I talked to the hospital, I realized, okay, there's the hospital's charges, then there's the doctor that reads the echo, then there's going back to my primary care physician, and my dad's cardiologist does them in the office, and it's a small family feeling business, So when I explained how Samaritan worked and that I was a cash pay patient, and I asked what he would charge for the echo in the office, it was 1/4 the price of the hospital, and that was just the hospital's charge there, without all the middleman charges that we're going to follow. And this concept of sharing one another's burdens, I love getting the monthly share that I give to each month that has the name of a real person, and their real medical concerns, and a prayer request, for them, and that I get to interact with people from all over the country, just like me, and get to pray for them and know that they're praying for me when I have a need. It's great. I love it. Well, initially, when we became members, I thought, what if this doesn't work? I mean, we're going to give up this whole concept of insurance, and we're going to trust God and His people. And I was like, yeah, well, of course. I'm going to trust an insurance company to come through for me, or I'm going to trust the church to come through for me. And that's a no-brainer. If I have a need, I know I can go get care. I can see the providers I want to see. I don't have to worry if they're in my network. And if we need medical care, Samaritan is there, and the church is there.